Washington, Oregon, Senator Alsobrooks.
Thank you so much, Chair Scott, Ranking Member Gillibrand, and thank you so much as well to all of our witnesses for being here today. Across the country and in communities throughout Maryland, physicians are telling us the same story. We hear that they are exhausted, overwhelmed, and increasingly unsure how long they can continue practicing in a system that demands more from them each year while giving them less time, less support, and less autonomy to focus on patient care. I had a medical appointment just last week and had that experience. The doctor came in, collapsed basically on the chair and said, I don't know what we're doing here, one patient after the next. So burnout is not simply about long hours. It's about physicians spending more and more of their time navigating layers of paperwork and trying to operate around complicated processes instead of caring for patients. It's about shorter visits, heavier caseloads, and constant pressure to do more with less. And it's about working in environments where asking for help can still feel risky or discouraged. In Maryland, I hear from providers who want nothing more than to stay in their communities and care for their patients, but who are struggling under administrative complexity, rising operating costs, and workplace structures that prioritize volume over quantity. These pressures are driving talented physicians out of medicine, and patients are feeling the consequences. Appointments are hard to get, wait times are longer, and rural and underserved communities are losing providers altogether. And exhausted clinicians face higher risks of medical error, directly affecting patient safety. This is not just a workforce issue, it's a healthcare issue as well, an access issue. It's a quality of care and system sustainability issue. And at the same time, the drastic Medicaid cuts in H.R. 1 threaten to further destabilize clinics and hospitals that serve as the backbone of primary and preventative care, forcing more patients into emergency rooms while placing even greater strain on an already stretched workforce. So we cannot afford to continue operating a healthcare system that is burning out the very professionals that we depend on. Now, I have a question, Mr. Feist, if I can start with you. And you have spent years working with hospitals, healthcare systems, and policymakers on efforts like Dr. Lorna Breen Healthcare Provider Protection Act to address physician mental health and burnout. And much of the national conversation focuses on helping physicians manage stress, but far less on reforming the structural conditions that drive burnout in the first place. So based on your work, can you tell us what are the most impactful preventative reforms that reduce burnout at its root?
I appreciate the question because you highlight the issue. The well-intended response over the last few years to the workforce has been to flood the market with a message of you need to be more resilient to health workers when they need the problems addressed at the root cause. What we hear from the workforce by asking them the same question you asked me is that the administrative burden is the #1 driver of their burnout. In addition, for nurses, the increasing issues around safety and threats and acts of violence against them are also driving them completely out of the workforce. The workloads are manageable if you think about the fact that the workloads can be manageable if you reduce the amount of administrative time that they're spending before and after work. And so that in getting health workers back to the bedside and back to getting into the direct patient care that they went into the business to do. So we need to return them back to what they trained for and eliminate as much of the administrative burden and other operational inefficiencies that stand between them and their patients every day.
And so workforce violence, I've heard a lot about workforce violence. And so how important is it that occupational safety and health administration develop clear federal standards to ensure that physicians, nurses, and other healthcare professionals can practice in environments that are physically safe as well as adequately supported?
Question back to me?
Yes.
Think about the Maslow hierarchy of needs. You have your essential needs of being able to be fed and watered, if you will, use the restroom. But then right above that, you have safety and feelings of just being physically safe and emotionally safe. It's critically important for our workforce. I mean, we don't walk in here every day without armed guards outside. And yet we send our health workers into an environment where they can be physically and verbally abused every day. And then we ask them to come back tomorrow and do it all over again. It's just an unsustainable environment for them to work in.
The system is. Just one last question. My time is going here. Prior authorization, and this is for Mr. Smith, has become a routine gatekeeper in medical care, often requiring extensive paperwork, repeated appeals and long delays before patients can receive treatment that their physicians deem medically necessary. So, from your perspective running medical practices, how does the current prior authorization system contribute to physician burnout, and what consequences do you see for patients when medically necessary care is delayed or denied, particularly for older adults and those in rural and underserved communities?
Yes, thank you. Prior authorizations are delaying care. There's no doubt about it. And, and just to back up for a second, burnout is not restricted to doctors. In some of our offices, we have over 40% of our staff turnover every year because they cannot last in this environment. It's that difficult. And I try to see every class of incoming employees, and I tell them, healthcare is not for the faint of heart. It is incredibly difficult, and I believe our front desk folks have the toughest job in healthcare. Not the doctors. It's the front desk. They need to be psychiatrists, insurance experts, best friend. I mean, it is incredibly challenging, all working under HIPAA, obviously. But prior authorization, slow care, we see that forcing folks to go to urgent care, in a lot of cases to the emergency room, because we haven't been able to get the authorization. We see delays in care. We haven't been able to quantify what that means in terms of additional dollars, but I think that would be worth looking at, because I think that slowdown, we keep saying we need to get rid of the administrative burden, but we also recognize that the government doesn't have unlimited money. So how do we work together to reduce those burdens so it reduces our costs, so we may not need as much of an increase as we had thought we did, because now we can get rid of some staff or rearrange some staff so we can get back to taking care of patients, because that's what doctors want to do. That's why they went to medical school. So I believe that prior auths are our biggest issue and truly need to be addressed quickly.
Thank you.